EPP stands for National Asthma Education Prevention Program. The purpose and goals are to raise awareness of patients, health professionals, and the public that asthma is a serious chronic disease, ensure that recognition of the symptoms of asthma by patients, families, and the public, and the appropriate diagnosis by health professionals, ensure effective control of asthma by encouraging a partnership among patients, physicians, and other health professionals through modern treatment and education programs. The NAEPP objectives for patients and the public are to increase public awareness of asthma as a significant public health problem, increase public awareness of the signs and symptoms of asthma, improve the knowledge, attitudes, and skills of patients regarding the detection, treatment, and control of asthma, particularly in high-risk populations, to define guidelines for effective asthma education programs, to promote development, disseminations, and use of patient and family education materials. The NAEPP objectives for health professionals are to increase knowledge, attitudes, and skills of all health professionals regarding signs and symptoms and management strategies for asthma, to encourage health professionals treating patients with asthma to adequately track and monitor patient status and to use objective measures of lung function, to assist and encourage health professional schools and continuing education programs to include up-to-date and accurate information on diagnosis, pathogenesis, and treatments of patients with asthma, to promote and encourage the concept of active patient participation with the physician in the management of asthma, to develop resources and materials for use by health professionals, to promote research to answer unresolved questions about underlying causes of asthma and appropriate asthma treatment and management practices. To diagnose asthma, you use the patient's medical history and physical examinations to determine that symptoms of recurrent episodes of airflow obstructions are present. Use spirometry in all patients that are 5 years and older of age to determine that airway obstruction is at least partially reversible. Consider alternative causes of airway obstructions. Long-term asthma management goals are to control your asthma by reducing impairment, and that's to prevent chronic and troublesome symptoms like coughing, breathlessness in the daytime, in the night, and after exertion. Require infrequent use of the inhaled short-acting beta-2 agonist for quick relief of symptoms. Maintain near normal pulmonary functions. Maintain normal activity levels like exercise and physical activities. Meet patients and families' expectations of satisfaction with asthma care, and to reduce the risk by preventing recurrent exacerbations of asthma and minimize the need for emergency department visits or hospitalizations, prevent loss of lung function for children. They would prevent reduce of lung growth, and provide optimal pharmacotherapy with minimal or no adverse effects of the therapy.